because you may injure the brachial artery. But since the size of the needle is very thin, it won't harm much. But anyway, you have to be very careful. When giving block, clavicle block and all, you must be very careful about the what? Brachial artery. So there are two types of blood pressure. One is one is up and one is down. So when you put this cuff, you will see you pump it to 200, right? And then it comes down. So while coming down, you will see, you'll hear the first pulse. It is called what?
Systolic.
Systolic.
Yeah, systolic. There are two types of pressure. What is systolic and
Distolic.
systolic?
Diastolic.
Diastolic.
Yeah, we got dystolic or diastolic. So if you stay in Philippines and all, you call it dystolic. And when you stay in India, we call it diastolic. When you stay in US, you call it diastolic. So systolic pressure from this to 200, and then the mercury or anything, you will see coming down, and suddenly you will hear the first pulse by pushing the stethoscope. That is called the systolic pressure. Recording of the systolic. And then again it comes down, and a place where the pulse stops. It is called diastolic. Blood pressure is classified into two parts. What are they? Systolic and
Diastolic.
diastolic. Very good.
Diastolic.
Yes, very good. Thank you so much. Now, blood pressure is the measurement of the force applied by the arterial walls. So it is the force which is measured by blood pressure is the measurement of the force applied to the arterial wall. So it is it's a measurement of force
Of the artery walls.
Yes. Applied to the artery walls. Understood? These are the basics you must always remember. You must know you must keep revising the basics. So that is why we say any type of stroke patient, you should always advise them to have their regular BP check at their homes because they may have the second chance of having stroke. Even after giving medicines, if the patient is having high anxiety, anxiousness, or depression, or because of family problems, the BP may go high. Even we see it here after taking regular medication, also BP goes high. So what do? Treat with medication, weight measurement. Weight means how much weight she is having, physical activity and proper nutrition. So one of the most important thing which you should shut down during high blood pressure is what? What do you stop? Which is the particular food which is first to be restricted? Can you tell me?
Salt.
Salt.
Which kind of salt?
Iodized salt.
It is sea salt, madam. Actually, sea iodized salt, right?
What about Himalaya salt?
One is called rock salt and other is called sea salt. Sea salt should be anyhow restricted in our regular food items also. Sea salt is not good for our health and it may increase our high blood pressure and it may result to the stroke cases also. So this is very important that all the patients who are having high BP should have regular checkup at the home taken by the electronics one and that can help them. So buying electronic one, you should choose a good company. And these days, you have many watches also, they say, but be careful. If you think anything which is not correct to yourself, have a manual check. Manual is always better than the electronic one. Clear? Am I clear?
Yes,
Yes.
sir.
Yes, sir.
Next. So healthy lining of blood vessel equal to smooth and elastic. Fatty substances in the food can build up the artery walls, causing them to thicken and lose elasticity. So what does it happen when you take a high cholesterol food, especially having LDL? There are two types of cholesterol. What are they?
HDL and LDL.
HDL and LDL.
And one is triglycerides. So we in lipid profile test we see generally HDL, LDL, triglycerides, right?
Yes.
So which is a good cholesterol and bad cholesterol?
HDL good cholesterol, LDL bad cholesterol.
LDL is a bad cholesterol. Why? Because it what? It can build up on the artery walls. That is, it can clot the artery walls and causing them to thicken and lose their elasticity. As a result, there are the chances of the backflow of the blood. So the blood has to go back, ahead in the journey. So you created a block. Because of the block, the blood will go back to the heart. यानी जिस ब्लड को आगे जाना था वो पीछे मुड़ के वापस आ गया. इससे क्या हुआ? हार्ट अटैक के चांसेस बढ़ जाते हैं. यानी if there is a clot, you may have the chances of having heart attack. Basically, myocardial infarction. They are divided into two parts: MI and cardiac heart attacks. Right? Generally, we find MI cases. So, whenever this type of blockages are there, cardiac stents are put up. One is BP shunt and what is cardiac stent. Am I clear?
Clear, sir.
The process of which plaques accumulate on the arterial walls. Now you will see this is a carotid artery, right? The artery which supplies blood to the brain is called what?
Carotid
Carotid
artery.
artery.
You are right. This carotid artery, if they have you continue eating this type of food, what will happen? It will generate a plaque inside. Plaque means atherosclerosis. Clear? With this atherosclerosis, you may have the chance of having what? Second stroke. You're eating food with high saturated fat and cholesterol. We already told you, eating food with high saturated food and cholesterol creates what? Deposition of cholesterol in these arteries, right? Which we call as plaque. What we call it as?
Plaque.
Plaques.
Very good. Very good. Very good. Smoke and HTN contribute. So now whenever you smoke, it will contribute to your hypertension. Why? Because it releases, it works. See, most of the thing we must understand, there is the involvement of the brain. So adrenaline and all, when it is released, tropigo and all, it increases what? Although it's a smoke, but it increases what? The chances of
Hypertension.
You are right. So now you can see atherosclerosis. So here you can see first one is the healthy one, first picture. And second picture, you can see what? Plaque.
Plaque.
What do you see? The plague. Can anyone please show them the plague in the artery? Walid, will you be able to show them with the cursor? Oh, acha, it's a PPT. Sorry, you won't be able to see with the cursor. Next. A blood clot can form and grow in the area of plague and may create heart attack or stroke. So, a clotting of the blood can be created. This clot can lead to death also. So, generally, in a bedridden patient, we call it vascular thrombosis can occur. This clotting can occur in the various arteries. Now, if you mobilize the patient with what? DVT, deep vein thrombosis, we call it. Right? What do we call? DV.
DVT,
So, what is DVT?
The vein
deep
thrombosis.
venous thrombosis.
Yes. Because of thrombosis, what will happen if you mobilize or you do any type of exercise? This the clot may break down. It may go to the heart, it may go to the lung, or it may go to the brain. So if it goes to the heart, it may create cardiac stroke. If it goes to the lung, what it will happen? It will become pulmonary embolism, which will again lead to the death of the patient. And third, if it goes to the brain, it may create a cardiac, or it may create a brain stroke. Am I clear?
Yes,
Yes.
sir.
So now we'll read the diseases of the heart. One is angina pectoris. Chest pain that results when the heart does not get enough oxygen. So what is angina pectoris? I have told you in tongue acupuncture. I am going to give you some points about angina pectoris. Right? So tongue acupuncture also helps in reviving from angina pectoris. So you will see sign that heart is temporarily or not getting enough oxygen. So in angina pectoris, you will see the heart does not get enough oxygen. But be careful before giving any type of treatment. You should have cardiac opinion. You should have what? Cardiac
Opinion.
or cardiac opinion and what? Proper care. Because these are all what? Life-threatening. So what do you see? What do you mean by arrhythmias? Irregular heartbeat. What do you see? Irregular
Heart pitch.
Heartbeats. Arrhythmias.
and most are
Most
common.
are common.
Next. So angina pectoris is what? A type of temporary chest pain. Now you have to be very careful about chest pain. One chest pain you will see in the center, right? It is because of hyperacidity. But once you see it on the other side, Anand, which side does cardiopectoris occur? Anand, Pain of angina pectoris.
Sir, it is radiating in the left arm, even up to jaw, shoulder, and
Yeah.
little finger.
Yes.
Yeah. So do not get confused with two things. One is hyperacidity pain. Here also you get chest heaviness and pain, cardiac radiculopathy, and cardiac pectoris. People often get confused and they give them what? They take it easily. So first is the loading dose. Loading dose consists of a couple of medicines, especially what? What is the loading dose? Any medical physician? Which is the first choice of drug?
Aspirin and digitalis.
Pardon me?
Sir, digitalis.
Digitally.
To cut.
Nitroglycerin.
We give sorbitrate or something like that one.
Nitroglycerin sublingual.
Sublingually we give, yes.
Yes.
Sublingual we give some type of medicine. Sublingual means
Oh, sublingual. Nitroglycerin.
nitroglycerin also we give, sorbitrate also we give. So even in our clinic, we have made the ECG free for the patients of stroke because we have to have a record. Because this type of patients may develop a sudden attack. We do not have the history of the what. Generally, all the patients who had a cerebral stroke because of essential hypertension must have what? They must have a reviewed cardiac opinion, especially because of if the ECG is okay, then fine. If the ECG is not okay, you must immediately go for what? You must go for what?
Stress test.
No, you must go for immediately angiography.
Angiogram. Okay.
You see whether there is any clot or not. Stress test and all do not result to various things. So angiography is the most important test in any type of heart disease. It's a conclusive study in many parts. And it is done before stenting. Shunt, before the shunt is put, we very good. Angiography. Now sometimes can be serious. Ventricular fibrillation. Like in ventricular fibrillations, what you will see, electrical impulses become rapid. Where do you find these electrical impulses? In the electrocardiogram, ECG, right?
Yes, sir.
Suddenly a patient came to me disoriented and then he was not able to hold her pain, right? And immediately when we saw the ECG, what did we do? We immediately did the ECG and we found the patient is having what? Cardiac stroke. And we immediately refer it to the cardiac hospital for needful. And most important thing is that is immediately followed in this type of commonly followed cardiac arrest. Heart stops beating, cardiac arrest is, heart stops beating means cardiac arrest takes place, and that can be followed in within minutes the patient dies. right? Am I clear?
Yes, sir.
So you can see the electronic graph of the ventricular fibrillation.
So we can't see the screen, sir.
Why? I am able to see the screen. Everyone is able to see the screen.
Yes, I'm able to see.
We can see.
Screen is clear.
Yes, I'm able to see.
What is written right now on the screen?
Ventricular fibrillation.
Fibrillation.
Huh?
Ventricular fibrillation.
Right, ventricular fibrillation. Right. So everyone is able to see the screen. You may please rejoin the class.
Okay, sir.
There may be some problem in the internet connection or
Okay, sir.
something we have pressed here and there. Take it and check out. Check out and check in. Heart attack. I already told you damage to the heart muscles caused by blocked blood supply. So this blood supply may be having a block because of which something is done. Most are sudden with intense chest pain. Yes, most of them you will find a rapid chest pain, restlessness, sweating, and referral pain, which is often on the left side. Clear?
Yes, sir.
Yes, sir.
So there are two types of stroke. One is cardiac stroke, sudden stop of the heartbeat, another is MI. So most of the myocardial infarction. So most of the patients today we see death is because of MI. Am I clear?
Yes, sir.
Yes, sir.
Yes, sir, I'm getting the screen now. Thank you, sir.
It starts with what? Mild pain or discomfort, which is mistaken for indigestion. So even in Rajesh case, we found that he was having discomfort and all, and immediately we followed the system, and immediately with immediate response, his life was saved. Generally, we mistake this for indigestion pain, right? Even in his case, we also mistaken. We have given one pantoprazole and then we gave him IV. But after 10 minutes, he did not respond. Then immediately we went to the hospital for a ECG, and as a result, we have purchased the ECG over here. Now we do the ECG of all the patients regularly, twice a week for common patients, those who are very sick patients, those who had serious history. We relatively check every day ECG for them. Or we put 5 paramonitors of this patient on this patient, right? Next. You can see the blood clot and a heart attack is done. So this is why I said in the very beginning, food is the medicine, medicine is not food.
It's not food.
Next. Congestive heart failure. Yes. The heart gradually becomes weaker to the point that it cannot maintain its regular pumping rate and force. Especially in old people, those who are suffering with many comorbidities, especially in COVID time, we have seen that the heart becomes what? Continuously weak. That is why we say in Hindi, chinta chita banati hai, because when you have higher tension, you have tachycardia, यानी heartbeat बढ़ जाता है. Clear? Heartbeat बढ़ जाने के कारण it continuously beats the pump very high. So if you have continuous tachycardia, the heart will become what?
Weak.
and it may result to what? Congestive heart failure. So you should always take care of your what? Mental health condition and other health conditions. And it can be a result of high blood pressure. Atherosclerosis, that is a plague, a heart wall defect, and a illegal use of or other factors. Means higher drug like ketamine and all these drugs may become what? Generally in US, what they do? They give a high dose of lethal drugs and they make the heart weak and the cardiac arrest takes place. Generally in surgical procedure, when we give anesthesia and all, we put the patient on what? Ventilation. Where do we put the patient? On?
Ventilation.
Yeah. So all this can be managed by only just because of the lifestyle correction. अपनी जीवन को सुधार करने से सब कुछ का करेक्शन होगा. Stress can be maintained by breathing exercises, which we in Hindi call pranayam. Maintaining good sleep will reduce what? The mental stress and repair the body, and good nutrition and physical activity. That is why all people you see, those who are good fit. Yeah, my health is not very good, but it's still good because continue for the whole day I do continuously do the treatment of the patient. So you'll see my physical activity, although is not very good, but also not very bad. Because for the whole day, I see 100 patients, so I have my own physical activity. Next. Stroke. So I already told you what is a brain stroke. Occurs when blockage prevents the blood flow to the brain. Affects different parts of the body depending on the part of the brain that is deprived of oxygen. It is called hypoxia. What it is called?
Hypoxia.
Now, can you please tell me in which type of disease hypoxia is generally seen?
Asthma.
Huh?
Asthma.
No, asthma is not the part of here. If there is a hypoxic brain damage, which kind of disease generally you find?
How about ischemic stroke?
Cerebral palsy.
It is called CPCI. Cerebral?
Cerebral palsy.
Palsy. Cerebral
Yes,
palsy.
you're right. It is called as cerebral.
Palsy.
Oh, very good. Now there are two types of stroke. What are they?
Hemorrhagic.
Ischemic and hemorrhagic.
Non-hemorrhagic.
Hemorrhagic and schematic stroke.
Very good. You all are very correct. Very beautiful answer you have given. One is ischemic and one is hemorrhagic. Clear? Ischemic stroke is called as infarct. What it is called?
Infarct.
Infarct.
Dr. Sastri,
Yes.
how about TIA, the difference?
TIA
Thank you.
is generally a pre-symptom to the stroke. generally you will see some type of what? The symptom is a certain weakness and it itself revives. Here you don't get permanent paralysis. In TI strokes, you don't get permanent
Paralyzed.
paralyzed. You don't have a permanent
Paralysis.
disease. It's not a, there is not a deficit. You will find a weakness. But this weakness is a what? Knocking door for stroke. So at that time, there are two things you have to understand. One is brain angiogram, we have to do MR of the brain and cardiac angiography. So cardiologically, you have to correct, and then you have to correct the vessel which is weak. That is called, you have to go for vascular anastomosis. What you have to go for?
Vascular
anastomosis.
Anastomosis. Yes, grafting of the brain vessels. It is done by a microvascular surgeon like IP Cherian and Lakshmina. We are also buying a neuro microscope so that I can teach you vascular what? Anastomosis.
anastomosis.
Yeah, in chicken beans. Next. So here you can see what? Ischemic stroke. It is the most common artery which is affected in the brain because of ischemic stroke. Can you name me that artery?
Middle cerebral artery.
You are right. MCA. What it is called?
Middle cerebral artery.
And the second one? MCA and
PCA, posterior.
no, madam. ACA. Posterior, it is akka, makka, pakka. So akka and makka means middle cerebral artery and anterior cerebral artery. Great.
Okay,
What?
sir.
In major component, you will see MCA and ACAs get involved. PCA does not get involved in many cases. Statistics wise, I have found MCA is mostly affected with ACA. Right? But again, it depends from case to case. Next. So here you can see hemorrhagic stroke. You can see how the artery is ruptured. And more the bleeding it is inside, then there will be a swelling inside the brain. Collection of blood leads to the swelling and it leads to the midline shift. So the great longitudinal fissure is called the midline. It divides the brain into two parts. So when there is a bleeding, there is a edema inside the brain. As a result, the suprasellar cistern is compressed. Now the choroid plexus, which produces CSF fluid, choroid plexus जो CSF fluid बनाता है, वो brain के अंदर swelling को बढ़ा देता है. It increases the edema inside the brain. Am I clear?
Yes, sir.
So what they do is they will go for keratotomy. Keratotomy means replacement of the cranial bone, right? As a result, the brain is what? It comes out. Herniation of the brain takes place. But in this condition, the patient stays for months and months in the where?
ICU.
Huh? What affects? What was my question? What was my question?
Your question was that when it happens, it can make the patient to be either maybe you did not complete the statement to stay long where I don't know. You didn't say it. Sir.
So midline shift happens, and then what happens? The patient may go to coma. So herniation of the brain takes place. Now, in TBI, generally we see what? You have a what? Injury in the brain. Clear? Someone's mic is on. This, mute the mic.
Pak Rashid, tolong ditutup mic-nya.
Yes. So meningeal artery is very close to here, and then when you have a trauma injury, the bleed ruptures and it bleeds. Whenever there is a bleeding, there is a swelling inside the brain. As a result, there is a compression in the supracellular system. Now, the fluid, trace of fluid is accumulating inside the brain, and the brain becomes more tensed and more swelling and swelling. But shifts the midline. Midline shift. So the more the brain is damaged, the greater the chances of death it becomes. Even if the patient revives, it continues to be in the stage of paralysis. So there are two types of surgery which are performed during these stages in hemorrhagic bleed. What are they? What are the two types of surgery which are done in hemorrhagic stroke?
So removing of the embolic.
No. It is carinotomy and cisternostomy. In 1905, carinotomy was formed. In 2012, cisternostomy was invented. One was invented by my friend, IP Cherian, other is carinotomy. Yes?
Rashid, please mute your mic.
Please.
Next slide. What are the diagnostic tools? We already told you ECG, MRI. In MRI, you will see the internal images of the body organs and can identify the heart damage. So MRI of the heart, MR is very important because we also come to know about the aneurysm and all in this case. Vascular aneurysm. Next. Next. This is called the QRS. Find in the, this is the MRI of the brain. Now, what other treatment options we have? So it is called coronary bypass surgery. What it is called? There are two things in the heart block we use it. What are they? What are they? What are the names of the surgeries we do generally?
Coronary bypass.
No, we call it vein
Angioplasty.
grafting.
Yes.
It is done by two types of surgery. What is called bypass surgery, where you create a bypass road, right? Another is called what?
Angioplasty.
Angioplasty, where you do stunting. Angioplasty with stunting, right?
Yes, sir.
With angioplasty, what we do, a tube with a balloon is inserted into a blocked artery. Balloon is inserted, dilated, and then removed. So balloon goes near the artery, it dilates and removes. Structure may keep open may remain to keep artery open, right? So here you can see in the first picture how coronary bypass surgery is done. Right? So one vein is cut down from your leg and all, and then it is grafted in the what? A bypass road is created from the blocked area, and the blood is passed by the bypass area. Now, patient is okay. Am I clear?
Sir, may I ask you one doubt, sir?
Yes, may I know speaking?
S.B. Nair.
Nair, sir, please tell me.
Sir, once in Dr. B.M. Hegde's lecture, he told this
We will
bypass.
discuss about that. That there are certain things where we should also know that blood maintains. If there is a block, you can also see heart has the capacity to what?
Additional growth of
Vessels they can grow, they can manage. But sometimes when you see that there is a cardiac stroke, right? Am I?
Yeah.
What will you do? Will you wait for the blood heart to rework again?
Correct. Emergency case. Correct.
We are discussing about emergency cases.
Okay.
You may not confuse it in your families. It was a confusion which we had. When a very good medicine doctor, Avinash, also was confused for 5 minutes. But then we had a discussion. Our joint discussion converted this case into MI in Rajesh's case. Rajesh had a heart attack while working here.
Yes, sir.
Was having discomfort for the whole day, right?
Yes, sir.
If you would have not given the loading dose of the medicines, right?
Yes.
And next day, you would have not given the IV of the heparin and all. What will happen? You would have practically died.
Correct.
So I don't say PM Hegde is correct, but he's not always correct. No one is always
correct. Correct. Okay, sir.
Next. So here you can see the narrowed artery. And now you can see the expanded balloon. And because of the expansion, the plaque goes up. And then you can say stunt. So yesterday they were asking me, any difference between the spellings? So it is called stunt. Shunt and stunt. The stunting is done here. So that the plaque does not disturb the blood flow. And it remains in the coronary artery. The stunt remains in the coronary artery. Am I right? First ballonoplasty is done, then stunting is done.
Inserted.
Yeah. Stent is inserted or insert stent. Stent is done. So stenting, after doing stenting, the patient is discharged within 1 or 2 days. He has to take rest for 7 to 10 days. And within 15 days, he can resume his normal duty, provided he does not need to lift heavy weights and less anxiety and happy life with good diet. Clear?
Yes, sir.
Next. Variety of medicines are available. I told you diuretics it's available because in CKD and all, you'll see large edema is there, swelling inside the leg, right? Eating edema, what we call, right? So the fluid is more inside the body. So it may result to what? Heart attack. So diuretics is used, right? What it is called? Diuretics. Cholesterol lowering drugs. Ecosprin, that is drugs to slow the protein, like aspirin, ecosprin, all this is used. Especially in the bedridden cases of spinal cord injury, also you will find certain clotting can happen in femoral artery and all because of what? Bedridden stage. So a loading a medicine called aspirin or ecosprin and all is given to the patient as a non-clotting agent. Am I right?
Yes, sir.
Next. Next. So because of irregular heartbeat, we call it arrhythmia, we have to place a pacemaker, right? So it sends steady electrical impulse to the heartbeat. Basically, when it becomes bradycardia, there are two types. One is tachycardia, one is becomes bradycardia, right? So there are two situations which may happen. A patient may have tachycardia, bradycardia at the same time, or it may become lower heartbeat. So when the heartbeat becomes low, right, it may lead to what? Heart failure. Clear? It may lead to
Heart failure.
So what do we use? Pacemaker. What do we use?
Pacemaker.
Yes. Nowadays, the latest pacemakers do not even need batteries. It is very good one. Otherwise, it becomes very difficult.
Maganda na magturo si Sastri man diya tutulog.
You can see insertion of the pacemaker. Electrode in the heart, so that the heart beating does not become irregular. Clear?
Yes, sir.
Like? CVD can start during childhood, and the health behaviors are practiced affecting your cardiovascular So cardiovascular disease can be been studied during a childhood period. So be careful, and that is why you could see those who have a very good lifestyle, very good, especially village people. Also, they don't have much cardiovascular disease than the urban population, because nowadays urban population is dealing with mobile phones. So you can see tobacco use, high blood pressure, high cholesterol, physical inactivity, excess weight, stress, drug and alcohol use. So all these things are what? Prohibited things. We must eat healthy food, gluten-free food, avoid artificial sugar. You see, even in my cancer's last stage, when I'm suffering, I don't use any artificial sugar. Am I clear?
Yes, sir.
Because of my fooding habits, even today my blood parameters are okay, and I'm working up to night 1 or 2 o'clock every day. Next. So these are the risk factors we cannot control. And with this, we conclude this chapter. So we have concluded 2 parts. One is what? It's very important part, because many people make a mistake. Even physicians today make mistake. Even I make a mistake. When in Rajesh's case, we made a mistake, right? So any type of restlessness in the body should not be taken as for granted, right? You may ask your question.
So you said salt, sea salt is no good. What about Himalaya salt?
Himalayan salt is accepted, because there are 2 types of salt. One is carries a sodium chloride, NaCl, and one is potassium chloride. So potassium chloride is good for body. It reduces the stress factor also. But sea salt is dangerous for our health, and it also not only increases the pressure of the heart, but also it creates many type of neuroinflammation by injuring the gut feature of the
Gut.
intestines.
So,
So rock salt, we call it Himalayan salt as rock salt.
oh, okay. Because in our part of the world, they call him, because they want to charge more, so they call him Himalaya salt.
Yeah, Himalayan salt, right? It is called rock salt, or we call it low sodium salt. You have to take. Very correct, Henry. You are very correct. More questions?
Sorry, I have to ask one more question.
Yes, please, sir. Please tell me your question.
When you have a plaque, given with today's technology, any chance of reversing once you have a plaque in
See,
the
it is always
artery?
better. See, now it depends on how much plaque do you have. So if it is less than 50% of the plaque, conservatively you can reduce, you can finish. But if there is a 80%, 90% of the plaque in the artery, then what do we do?
A surgery, I guess. I mean, you have
It
to
is better
do
to have a stenting or a
stun, yeah.
maximum
But through
cases we call angioplasty.
through your diet, meaning that food, change of food or lifestyle, can the plaque be gone, disappear?
No. At present moment, to the best of my knowledge, it is no. But that is very important that secondary plaque should not occur.
Oh, thank you. Okay, so you don't want to
Because that
say
is the
you have,
primary what you are speaking, but the disease does not stop at primary level. Na?
okay, thank you.
Thank you, Henry. Thank you so much for your kind participation.
Anytime, sir. Anytime.
Your laugh and smile itself is beautiful.
Your lectures
But
refresh a lot of things that we learned in the past, but
see,
sort of
generally,
it's
we
dawned.
also try to take these lectures to refresh our knowledge, because when we deal with too much in neuro cases, when we deal with only one particular, too much with acupuncture, brain mapping, and brain stimulations, our clinical knowledge becomes very weak. That is why we take this CMEs, we call continuing medical education program, to revise our own subjects.
Yeah.
It is very important that we continuously revise these subjects, because when we deal with a patient, when it is in patients, you may have any type of trouble, because we don't have the various what awareness in the patient. Generally, when there is a brain stroke, patient does not go for angiography and all, right?
Well, when you have a patient like that, you normally don't see it. I mean, I don't normally see it. They will be referred to a cardiologist. So why
Generally,
you
in
see
India,
it?
that is not such a system. Even the cardiologist does not go for angiography in a stroke patient. Angiography is must in all this patient. When the patient is sustained with the stroke, angiography is must. One is MR. Any type of infarct, we should have what? MR or color Doppler of the carotid artery. Yes. Because atherosclerosis may lead to more than 60% of the atherosclerosis. If there is a 60% plague, it may result to what?
Hemorrhage and stroke.
So, very good. So, Walid, can you go to my Facebook? I'd like to show you one very beautiful case we have done.
Let me load on the browser, sir.
Hi, G.
Yes, sir. Please tell me.
I have a question.
Yes, sir. Please tell me.
Yeah, at what stage would you administer the adrenaline?
Pardon me?
Adrenaline. At what stage of condition?
At what stage?
Of condition would you administer adrenaline?
Adrenaline.
Yeah.
Generally, when there is a stroke, heart attack is confirmed, cardiac stroke.
So is that the first step?
It depends what comes. Generally, when we see there is a heart line is flat or is just to be flat, we give them what? New adrenaline, dopamine, and all this medication.
Dopamine as well.
Dopamine is also given. New adrenaline is also given. Generally, those patients who are in ventilation, with the help of syringe pump, we push dopamine and new adrenaline. On hourly basis, because after some time, the effect is reduced. So, with the help of the syringe pump, we keep the heart alive.
Start the heart. Huh?
I like to show you a beautiful case where laminectomy was done, and after 15 years of surgery, the patient became paralytic. The patient was operated 15 years, he did 15 years of his good work, and suddenly he became paralytic, was unable to walk. And we revived this case of neuropathy in just how many days? 20 days of OPD.
Sir, which video do you want from your Facebook page?
Today's second video. First video also you can show, it's a very interesting case where two autistic child are socializing each other. They met for the first time, and you can see how beautifully they became friends and how beautifully they came out from ADHD. Autism and ADHD. People say there is no treatment for ADHD. But you can see these two cases. Yeah, here this is a case of we are not able to hear anything. Can voice be enlarged? Yeah, this is the patient. Let me give the history of the patient. This patient was operated around 16 years back. So now if you see 2021, go 16 years back, it is around 2000. कितना होगा 2020 में से 16 काटा तो is around 2006, 7. This patient was operated with laminectomy and discectomy. After surgery, he became paraplegic. He was unable to move, and then he revived. After 6 months, he joined back his work, but he had a neuropathy. After 15 years of his suffering, within a single day, he became paraplegic. Again, he became paraplegic. And then he was unable to walk. And then he developed a severe foot drop and he was walking with arthrosis. Now you can see the same patient walking without arthrosis and he is revived to almost 60 to 70% of the case. Within 20 days of OP treatment, not inpatient treatment. You may please see the video. Hyderabad से with my team of physicians. यहाँ आप देख सकते हैं कि this is a foot drop case. काफी इम्बैलेंस था वॉकिंग में. इन्होंने 15 साल पहले सर्जरी किया था. देयर आफ्टर वो पैराप्लीजिक हो गए थे. तो सर्जरी वाज डन एट L3 L4. ये देखिए सर्जरी पोस्ट सर्जिकल मास्क. आप कितने साल पहले सर्जरी हुई थी? 2007 से. फ्रॉम 2007 ऑनवर्ड्स ये पहले तो 6 महीने वॉक नहीं कर पाए, फिर चल पाते, फिर 2 साल बाद पहले 2 साल पहले काफी प्रॉब्लम हो गया. हाँ चलने भी नहीं आ रहा. अभी 2 साल से लास्ट 2 ईयर से. अब बैलेंस है. अच्छा मेरे हाथ पकड़ी. So now you can see there is no foot drop. They are having serious foot drop. Now you can see there is no foot drop. Patient is not even losing balance. Not even mild support you can see. He is walking by himself. चलिए. Touch कीजिए. चलिए. Anand, can you tell me how much foot drop do you see in this patient?
There is no foot drop, sir. Foot is clear. Ground is clear totally.
So there was serious damage in the common perennial nerve which was done in last 2 years. So he was having motor and he could not even walk. Now you can see him walking independently. Now you see how much sensation he has. Sorry. You can go with the first video of today. So you have seen whether he is having the pain sensation or not. Earlier he was not feeling the pain. कौन सा पेड़ में था? Now you can see sensory deficit 1 minute. You can see the sensory deficit also has recovered.
You can say with minor tweaking. आप देखिए हो रहा है हो रहा है हो रहा है हो रहा है इधर हुआ हो रहा इधर देखिए हो रहा हो रहा हो रहा गुड आपका सेंसरी नर्व रिकवर हो गया तीनों तीन होते हैं कौन पेरिनियल नर्व टिबियल नर्व ये सारे रिकवरी में है So here you can see a significant change in a patient who was suffering from last acutely from 2 years, post-operatively 15 years back he was post-operated, and thereafter he got surgery done 2007, but he got chiefly affected 2 years back. So even in spine surgeries, if we say that the problem is solved within 2 years or 3 years, it is not. There is an example that the neuropathy which he developed was after 2007. So those are the kitna 2021. So around 13 years back, he developed acute symptoms. Now you can see the patient is doing good and the activity is also good in this case. So with this we can conclude that
We will go to the first slide.
You
will really enjoy.
Many years
Okay, now you can. His motor and sensory deficit has been recovered. We'll go to the first slide of today. No, one down. Yeah, this one.
Sastri, and we are in Hyderabad, and you can see there are two autistic child with hyperactivity. Now you can see how much improvement in there. Now you can see this boy is helping the another child. See?
You can see the one autistic child, a hyperactive child, supporting the other one. You will see one more beautiful story. He was treated in US for many years, and there was no result of any integrative therapy. They visited the best university also of the US. Now you can see. And they met for the first time. It was my initiative to integrate these two families which used to come to me. They went in the mall today, and this first boy who was the autistic child took care of the second autistic child.
What, like this? Oh, very good.
So you can see he has started going to school. The second autistic child with hyperactivity. This one, the one who's sitting in the sofa.
This, your son. Srijan, how much he has improved?
Yeah, hyperactivity is reduced by 80%. Yeah, more than that. I'm able to manage him outside easily.
You have managed to. Because you have treated him in US also?
Yeah.
What was the outcome there and what is the outcome here?
Nothing, everything was temporary. I mean, and too expensive.
Yeah.
Nothing happened. Like I tried all kinds of therapies.
There.
Homeopathy, biomedical treatment, lot of therapies. I don't even remember the names.
And what is the outcome here you have seen?
The main thing is behavior, lot of control. Like before, like it used to be very difficult for me to take him outside. And now he is like with me only.
Oh.
He's not running away or like he is holding my hand and coming with me. It's become easy for me to manage.
Even your mother has managed him, na?
Yeah.
Huh?
Yes.
So
Without me, she was able to manage.
Now you can see another autistic child. You see, they are better than the adults. See, 2, 3, 4, 5, 6, 7, 8, 9, 17.
You can close it.
Today from morning we are making them
You
alert.
can close the film. Close the film. Yeah. Now you may ask me your questions.
Good evening, sir. This is Anand Maurya. Sir, is the myocardial infection, can we say it is the death of brain?
Pardon me, Anand?
Can we say myocardial cardial infarction is the death of brain?
No, no. Myocardial infarction does not lead death to the brain.
I am thinking because the cardiac muscles is the involuntary muscles.
See, generally you are right. It's the death of the brain because it leads to hypoxia.
Okay.
What you are saying is also correct. One way correct. But then let us not make it complicated for others. Because when there is a heart attack, right?
Yes, sir.
The first thing which will be damaged is what? Brain.
Yes, sir.
So there is what? Brain dead.
Yes, yes, so we can say that.
So MI may lead to brain dead. Second question. So there was a question whether peripheral neuropathy and all can be recovered or not. So we have started working on the evidence. Shortly we are purchasing one laptop and then EMG, NCV, EEG machines and all we are purchasing to prove you medically that these things can be recovered. Clear?
Yes, sir.
Sir, I want to ask you about the questions on the kids. How long did the kids see like treatment for?
See, this type of cases have been already treated for 9 to 10 years. They have been
No, I
treated
mean the kids itself.
by me, they have not been treated regularly. They come on their way. So by now, I have treated them. One I have treated for 2 months regularly and then irregular basis. And the one I have treated, the one with the cap, I have treated for 1 month, 30 sessions. But then I just insert the needle and I leave it. My treatment is that much on. You have seen my treatment. I insert the needle and the parents of the patient, they remove the needle after 3 hours of the insertion. So my treatment is only of 1 minute.
And so the kids comes in 3 times a week, or
We do not request them. Let them decide.
I see.
Let the parent decide. We advise them what is, because everything has to be viable. Their parents, their social life, they should have time for their children, right?
Okay, thank you.
So we cannot impose our rules on this because this is not an emergency treatment. Case is only where we have an emergency case. These are not emergency patients.
Yeah.
More questions?
Dr. Sastri, could
Yes,
you
yeah.
explain the correlation between diabetes and strokes? I mean, how would that actually trigger in some sense?
See, high diabetes may result to many diseases, not only stroke. It may also result to CKD, chronic kidney diseases, right? Because in any cases of artificial sugar, because high diabetes is relevant to high artificial sugar. Natural sugars, fruit sugars, fructose and all that do not create the body is capable, because there are two types of diabetes, type 1 and type 2. So in fructose, generally which is generated from fruits and all, but that also should be taken in limit. So the body has the capacity to digest them, because it is recognized by the body. But when you take artificial sugar, like ice creams, no, I don't eat ice creams. Earlier I was fond of ice creams, but these days I've stopped all these things. And after I stopped, I saw a very good improvement in my health and in my brain. My depression has been reduced to how much? 99%, 95% has been reduced. Earlier, I used to take a lot of sedative drugs to make myself sleep. Now, at 2 o'clock or 3 o'clock, I can close my eyes and then I can think over the issues for the next day's treatment. I don't need much sleep to sleep because my body is used to it. And up to now, I did not develop any neurodegenerative diseases. Up to this level, 30 years of hard work also did not. Yeah, it has created some spine problems, but not my neurodegenerative diseases. We have been working day and night from the year of when I was of 12 years. So now you can understand what is now around 41, 42 something. Neuroinflammation, Parkinson's, all these things are created in a diabetic patient because of artificial sugar.
Excuse me, sir. So we get cubes, sugar cubes. Those are artificial or natural?
All
sir?
these are artificial sugars.
Okay, sir.
Natural sugar is like jaggeries. But whatever you mix with this sulfur, white
sir.
sugar, you mix
So,
it with fruit juice, you
jaggery
mix
sugar.
it with this, all this item is very dangerous for your health. That is why you get many ADHD case,
How about
ADHD
sugarcane
cases.
juice?
Sugarcane juice is a natural sugar, brother. You can take that.
Okay.
Thank you, sir.
What about brown sugar?
Brown sugar, I do not know how they make it. I don't have much idea because, you know, I'm not much aware of the fooding because I eat very less. So I know what not to eat. But if you ask me the classifications, I've never seen brown sugar in my life.
Pranam, sir. Brown sugar is nothing but not a refined sugar.
Oh, so I don't know much about it, madam, because in my food, generally the question is that everyone has a good home and good lifestyle, right? Generally, you all have a good family and good lifestyle. But in my case, I was devoid of family and being out of the home, I do not know what are the ingredients used in the kitchen. So if you ask me what not to eat, I can say what is written in the book, what you cannot eat. But if you ask me to classify it, it's very difficult for me because I don't know. I have never seen what is brown sugar. I heard about it, but I did not see it. Because generally our whole day is spent in the what? Morning up to night, 2 o'clock we spend in the clinic. In between we take one dosa and little rice at night, 2 o'clock. That also they mix. What they mix, that also I do not know. They mix everything and they give it to us in the rice. And we take it with a spoon, 5 or 10 teaspoons we take at night. And then we leave the rest of the food. That's all. So we do not know what they have mixed, what type of vegetables they have mixed, how they have made. It is none of my idea. Because I am out of touch from this habit from last 30 years. Little bit Gita has educated me. But Gita, the patient you have referred me, her back pain has been recovered.
Oh, thank you so much, sir. She messaged me.
Earlier the husband
And
was thinking it's psychosomatic. But then I explained him the MRI. You see, there is a facetal arthrosis, there is a disc prolapse. So what your wife is complaining is not a psychosomatic disease. She says you go with the minimum treatment. I said I never go with the maximum treatment. Who would like to go with the maximum treatment?
Okay, anyway, she's
There
happy with
are
the
two types
treatment.
of treatment, I said. One is aggressive treatment, which is neurosurgery. One is this what I am doing. So you may decide what you want. You don't want to go for surgery, then this is the best care you can give to the patient.
Thank you, sir, for treating her.
I should thank you. You have always supported me.
And one more boy is also coming to you, no, sir?
That boy, yes, they have gone to Bangalore, but her mother messaged me today that after the first needling, he was very happy and cheerful.
She
It is
messaged
post-COVID
me saying
psychosomatic.
that she'll come tomorrow to you.
Yeah. They went for a vacation. I did not say anything. And but they said me that after the first needling itself, it is a post-COVID, post-traumatic stress disorder, PTSD case. It has
Yes, and
happened
they
because
gave
of
lot of medication and all for
they have given
nothing.
a lot of antipsychotic drugs, which was not required actually.
That's the reason when she told me the case, I said immediately take him to you so that you can stop all these medications, unwanted
They
ones.
requested me to stop it all at the time. I said, no, first you have to revive the patient and then you have to taper it.
But unless they come to you, they can't get out of medication. That's why I wanted them to see you, get treated, and then come out of medication.
Yeah,
Thank you for
even three of them are good. The patient is also good. The parents are also good. And the father is also very nice. In this case, I think we will be able to revive the patient because the attendants are very good, very cooperative, very kind.
You are an excellent doctor, sir. Then everybody will get recovered. Don't worry.
There is no one called excellent. It is only how much time you spend in your clinic. That's it.
Anyway,
We are unmarried people. We don't have children. We don't have families. So we spend our 18 to 20 hours in the clinic. So ultimately, you learn more when you work more with the patient, right?
Yes, sir.
Why we take this type of classes? Because we became more interested in brain mapping, and then I saw that, oh, I've forgotten many things of MRI, I've forgotten many things of CT scan. And then I said, no, this is the right time for me to what? Take the classes. From now on, we will go on the diagnostic part, like CT scan, MRI, and then we'll also go for orthopedics. So much of the brain inflammation, cardiovascular system, we have taught to you. So you may, now we'll go with what? Orthopedic studies and then diagnostic part, MRI, CT scan, how to read the neuroanatomy. We'll revise the neuroanatomy, which will help us to study about what? The MRI of the brain. First, we'll try to study about the CT images, then we'll study about the brain MRI. Am I clear? So by the end of the time, we will know a little bit about how to study the images of the brain MRI At least spine you will be able to understand a little bit about the spine MRIs. T1, T2 images, T1, W1 images. These are the different frequencies of MRI, which you will see different types of images and different types of what? Diagnostic used. Under which frequency you can see what? How to diagnose a tumor, what kind of tumor it is. Right? You must be able to see many reports we have seen reported by a doctor without seeing a patient. Generally in India, the MRI is done here and it is sent to a remote corner of India. So it has been reported on the basis of images, not basis of the clinical condition of the patient. So sometimes what they write, to avoid medical legal problem, they write little about the disease, right? So we will be going with MRI and CT of the patient. Clear? And also orthopedics. Orthopedic is very important. We have to revise it. And then it will be easy for us if we revise all these things so that treatment of this becomes easy, especially for the non-medicals, that what they can do and what they cannot do. Clear? Am I clear to all of you?
Yes, sir.
Yes, sir.
Yes, sir.
So any
Yes,
more
sir.
questions for anyone?
I have a question here, sir. Naomi from Nigeria.
Any more questions?
Yes, I have a question.
Yes,
My,
madam,
my,
please tell me.
my question is on stroke, where there
Yes.
is impairment of speech. How can that patient be helped, sir?
What was her question? Can anyone tell me?
Stroke.
What I'm saying is
stroke.
there is stroke in the patient and there is speech impairment. There is
Speech impairment. Yes. Yes, you can recover the speech impairment by stimulating the hypoglossal nerve. First, you have to work with these muscles, then stimulate the hypoglossal nerve with scalp needling over this area.
Okay.
There's a practically, I'll also make a video and I'll give it to you so that you can learn a little bit about it. Generally, we have our clinic becomes little busy because we have to treat around 100 patients a day. By 7 o'clock, we started around 11 o'clock and we have by 7 o'clock, we have to complete everything. And again, 9 o'clock will start. So you have to see what we can do for you. Make a tutorial and give it to you so that you can understand clearly, right? So that is in my mind. Let me know how to operate this camera, which we have purchased. And then we'll come back to you on this issue so that the images and everything is very clear to you, right?
Thank you, sir.
Any questions?
Dr. Sastri, I'd like to ask,
Yes, Jan.
how
Yes, Jan.
can diabetes also affect our brain capacity?
I told you na, that this artificial sugar damages the gut.
Oh, okay.
So whenever you see, we have already taken one class in between, that gut damage may lead to neuroinflammation. So artificial sugar, gluten, all they lead to what? Gut inflammation.
Inflammation of the gut.
They infect the gut. So if in details, you can see neuroinflammation, and you are supposed to take that class also, how diabetes affect the brain and gut. So I'll give you that video. It is there in YouTube. You may also search out. And from there, you can see very clearly that how diabetes damages the gut, and from gut, how vagus nerve damages the neurodegeneration. It's called neuroinflammation of the brain. Am I clear, Ian?
Yes,
Clear.
sir.
Yes, sir. Thank you.
I'll give you a detailed video of that. It is there in the YouTube. You can see that. Very good question. It is very good question. Actually, you have asked this question in public importance, and we must know the gravity of this question. Any more questions? So thank you so much for your kind cooperation. I appreciate your support in future also. Thank you for your kind blessings. Thank you for all your time what you spend with me. Thank you for all the time you
Thank
spend
you.
with
Good
me,
night,
because
Sastri
this
ji.
is only
Thank
my
you, sir.
refreshment. Coming to the class is only my refreshment.
Thank you, sir, for
Thank you,
teaching.
sir.
Thank you,
Pranam,
sir.
sir. Good
Thank
If I
night.
you.
don't take
Thank
class,
you.
I'll become mad.
Thank you.
There is no other way I have a time pass. So taking the class is only my what? Refreshment.
Relaxation.
Refreshment.
Yeah, I
Thank
get
you,
only
sir.
1 hour relaxation in this whole day. It is with you. Otherwise, I am busy from 11 to 3 o'clock. And 2 hours I spend on my research, 2 to 5. Again, then I take rest for 1 hour or half an hour. Again, I continue my thinking process. And then I am just back to the, because our inpatient round and everything is completed by 11 o'clock. Then I go to the clinical area, and then I continuously work up to night, almost 2 o'clock. Our clinic is completed at 2 or 3 o'clock, and I sleep by 5 o'clock, 5 or 6 o'clock in the morning. I don't sleep, I just take little rest. That's it. Thank you so much for your kind cooperation, blessings, and being with me. Thank you, Prakash ji. Prakash ji, hain aap? Prakash ji? I think Prakash ji is not there.
Sir, bolo.
Thank you so much for everything.
Okay.
और तो कोई आपको कोई सवाल आपकी तरफ से?
नहीं कोई सवाल नहीं.
चलिए, thank you so much for kind thing. Thank you for making me punctual also. Thank you so much.
Pranam, sir. Thank you so much.
Thank you, sir.
Thank you.
Bye.
Thank you, sir.